So when it comes to the immune complexing that happens within an animal, this can happen in any host, dogs, cats, human. It's actually a normal response to whatever infection, right? That's your body's job, is to make antibodies. Unfortunately, and for reasons we can't necessarily predict, sometimes those antibodies target what they're supposed to, right? But unfortunately with heartworm, what they target is what we're trying to detect to know if it's even there. And so the mechanism by which that actually happens in a pet, we have no way to predict whether or not that's going to happen and to what extent. It probably happens in every pet. But fortunately, our diagnostics are good enough that most of the time it doesn't matter. But in some instances, it does. And the immune system is doing its job. And there's not enough antigen left outside of what the immune system has bound up to allow our tests to actually work the way in which they're intended. And so the end result of that is you see what looks like a negative or no antigen detected test. We think, well, dog doesn't have anything, cat doesn't have anything. Well, there could be these unique situations in which we just can't detect what's actually truly there. So when should we suspect an animal might have an immune complexing going on? So if you detect something, say microfilaria or clinical signs consistent with heartworm, that's something that should lead you to think, hey, maybe this negative test that I think I'm seeing really isn't negative, right? Or if they have an intermittent prevention history, if they've not been on prevention, if it's a new adoption or a shelter animal, something with a history is unknown, and you still think, hey, maybe heartworm's actually likely in this dog, that's when you should really look into pursuing additional diagnostics.